material of the mask that has been provided. So I think it's one of the things that we've also emphasized that it must improve. The next slide. The slide, I think the colleagues, one of the things that we've agreed as a sector that we must share the stats and make sure that we are all aligned on the stats. So what we've done, we've also done a comparison of local and global stats versus mining. And I think Dr. Balfour has touched on that. I'll not also talk more, but you can clearly see from that slide that in terms of the testing rate by population, the mining sector with the 23%, in South Africa, we're 14%. The next slide. Similarly, the comparison of the COVID cases globally, the positive cases by the 8th of this month was about 106 million, and also there were 78 million recoveries. South Africa, you can see the figures there, they are close to about 1.5. In the sector, we have 28,000 cases, just above 28,000 cases as indicated on the slide. And by the 8th of February, we had 212 fatalities as indicated on the slide. Next slide. We also we're indicating the comparison on the recovery rates and deaths. The mining sector, in terms of deaths, is about 1% of the population, and also there's been 96% recoveries as highlighted previously. I won't talk more on this slide, but what has been encouraging for us on this particular slide is that from the middle of July, you can clearly see that we've reached a peak there, but there's been through the measures that we've been implementing together with the sector, then we've seen an improvement until the second wave that the country has also experienced. But we can clearly see that's encouraging that the figures are also coming down. Next slide. Dr. Balfour on the same slide. We can move on this slide. Similarly, I've covered on this slide to say what is encouraging for us. We have a high recovery rate. In terms of conclusion, I think led by the minister and ourselves as officials, we continuously collaborate with the sector. We engage with the sector through the Mine Health and Safety Council and bilaterals as well to improve on that. And we will continuously ensure that the mines are vigilant, especially during the lockdown period, to make sure that we take down the cases. And lastly, we will continuously do the monitoring of mines. And where necessary, we will take actions, including the issue. Honorable Chairperson, honorable members, and DG. Thank you.
As we conclude with our presentation, the last point that Mr. Msisa has covered, I think I must highlight this point that both the Department and Minerals Council, we have a very good working relationship where we need to differ as a regulator. We do actually do our work as a regulator because we can't differ, because as a regulator, we need to do what we are established to do, which is the regulatory work. And so there is an appreciation as well from the members of the Minerals Council that where there is non-compliance, then the regulator will be able to do what is required, out of the regulator to do in terms of the law. That is one point that I thought maybe I should just cover, Chair. The other issue, Chair, that we welcome through this collaboration between government and the Minerals Council is the fact that we have been able, to come up with measures, as Mr. Baxter has indicated, that there is a proposed contribution by the Minerals Council, in assisting government, and we welcome that. And so you remember that the President also spoke about this, contribution by the Minerals Council, and also when you look at individual members as well. The rolling out of the vaccination campaign, we are very much in support. We are working together with the Minerals Council as well. Over and above that, we know that we're also playing our regulatory role. Funding that we are also very much grateful of that. The issue of partnership, it is there, and we have realized that it is through this partnership that we can be able to achieve more. Thank you very much, Honorable Chair and honorable members. Thank you.
Okay, thank you, DG, and your dedication from the department for the presentation that you have made. I hope I'm audible enough for your ears. Honorable members, I think for now, I won't do that much to limit your time, but I won't open it up that much also for no apparent reason. I'm not limiting because we may have to do comparative work. We may have to have an emphasis on one of the two reports, and they will be ready to take the pen. Where it relates to, I only request honorable members, it must be clear where the question, if it's a clear question or the comment is related to, whether to the Minerals Council or to the department, so that they can also be able to take notes. For now, I'll open up for members. Depending on the comments, questions you ask, I may have to halt you before you finish all of those hands that are being raised. I now see the hand of Honorable Milam. There's a hand of there's the hand of Mamo Valencia. There's a hand of Honorable Masaule. In that order, for now. Honorable Milam, when you finish, I don't have to come back to Honorable Malinga. She will know that when you say full stop, she will start her own, and Honorable, except if I stop you. You can go ahead, Honorable Milam.
Thank you, Chairperson. Chair, my question is primarily directed to Mr. Baxter, and it relates to the potential rollout of vaccines. You've indicated that you can do roughly 60,000 vaccinations per day in the sector through your own members' facilities and resources, and that's very impressive. The President indicated that no one would be forced to take a vaccine or the like. And my question relates to that. Are you going to require that anyone has to have a vaccine before they go underground or work in a confined environment? It seems to me that there's a little bit of a problem here in that we're forcing people into an enclosed space, but we're allowing people who are not vaccinated into that environment to work in closed confines. So I'd really like some clarity from yourself and possibly from the department as to what sort of protocol we're going to put in place to ensure that everybody is safe and that the vaccination is rolled out effectively. Thank you, Chair.
Thank you, Chairperson. Greetings to yourself, other honorable members who are here, delegation from MINCOSA, delegation from the department led by Advocate Mgwena, our support staff, Babu Ari Kokutse and Ayanda Boss. Greetings. Chairperson, I have, I think, about 2 questions. Vaccine preparedness slide. Chair, that is on MINCOSA presentation. How possible it is to vaccinate 2.5 or 3 million employees and their families in 3 months' time? Is that doable? Does the sector have the energy or manpower to do that? That will be my first question, Chairperson, because we need to be sure who will be used, because I think from what we've been hearing on the news, we have about 1.2 million health workers in the country, both in the public and private sector. So who will be used to vaccinate employees and their families? On the department, before that, Chair, there is a slide on analysis of death. I think it's a pie chart. There is male and female, then there's this yellow smaller part where they say it's unknown. Can a gender not be known of a person? Or am I getting it incorrect, Chair? On the department side, Chair, are they not concerned about the 28,000 plus positive cases in the sector? Are they fine? Are they worried if they are going to lose, or whether they are going to lose so many employees? What are the mitigation strategies not to escalate people with who are infected with COVID-19? Chair, thank you very much.
Thank you very much, Honorable Chairperson. Greetings to the DG and the colleagues. Greetings to my colleagues. Chair, the first point was covered by Honorable Malinga on the gender issue. It's possible that it's unknown, but I think we ought to be told what is meant by unknown gender in this regard. The second issue is not really a question with MINCOSA on the vaccine preparedness. It's just to show appreciation of the collaborative level they have with the department, and also to see that in the presentation by the department also there's appreciation of the collaboration with in the words of Honorable Milam, it's quite impressive that what we see in that slide. And I just wanted to point, Chair, is on the presentation by DMRE, specifically on the SOE's COVID-19 statistics. If you look at MinTech, there is, and I'm giving an example, there's a number of them that have this question mark. You have 31 reported cases. It's reported. It would be 25 reported recoveries, right? And 0 fatalities. Now, from the reported cases that are 31, and you have 25 that have recovered, what happened to the 6 that are not dead? What is their status? Same with CGS, 29 recoveries, 27, 0 fatalities. Where are the 2? Take us through on other people who are not put here in the slide. Other than that, Chair, I think I'm quite happy with the breakdown of work-related and home-related, because it doesn't mean that when you are home, working from home, you don't get COVID. Thank you, Chair.
Okay. I guess there is no other take on this matter. Maybe let me. Oh, Honorable Matog.
Thank you, Chairperson. I thought you were going to call another round. That's why I did not raise my hand. But nonetheless, I have questions to both MINCOSA and the department. And I think I'll start with the one to MINCOSA, because I think there's a sort of, I think it's a clarity seeking question perhaps from both the DMRE, for instance, in their report. They say that some of the findings are that some of the mines do not have PPEs. Whereas the report that we got from MINCOSA, on the other hand, gives us an impression that everything is under control and they are now looking into the vaccination process. So I just wanted to find out what exactly is happening. Are they sure that all the mines that are under their control or under their supervision do have PPEs? And then also, why would you then have funds or be able to prioritize vaccinations, whereas the most basic things, which is making sure that miners have PPEs, has not been attended to? Because if that is the case, then it means that some of the infections that we have and some of the deaths could have actually been prevented, considering that there are funds. And then I think on the issue of, I think it's slide 9, and then also the department, or now on the department's presentation, where they say that they have done like 6,000 plus 6,000 plus audits and inspections. And I think that I just wanted to find out what were the outcomes of those audits and perhaps what were the implications for those. I see that they do say that they've issued instructions, but beyond instructions, what is it that the department is doing? If you get to a mine, it does not have PPEs, it is not adhering to COVID-19 rules. What harsher measures are there in place? Surely instructions should not be the only thing. And why isn't it that if mines do not have PPEs and they are not adhering to COVID-19 rules, why are they not forced to stop operations up until they are able to display that they actually now are ready to operate? And I think also it's just a question on the proposal. I'm not sure I think either the department or MINCOSA would be able to assist. I think that the proposal by MINCOSA of offering funds to assist with the vaccination itself, I think it would assist a lot, it affects everyone and all welcome. But I just wanted to find out, because it's not the first time that I've heard that they have made the proposal. So I'm interested in when this proposal was made, what are the discussions around that, and perhaps when is it that the proposal and when could it actually be actioned out? So those are the 3 questions that I have, Chairperson. Thank you.
Okay, thank you, Honorable Madam. No, I gave you at least few hands that were raised on the first round. So I thought when you raised the hand, but having said so, I'm dealing with well-seasoned swimmers. So do your best or what you are known of and swim. Minerals Council, because they met, can you take your questions that were related to yourself, and then the department will respond, will also respond on the issues, including the comments and the questions of clarity that were made.
Well, Chairperson, yeah, thanks very much. Honourable members, thanks very much for the detailed questions. Honourable Milam, I think just to answer the specific question, I mean, we would never force anyone to take a vaccine. It's even, you know, in the sector, we don't force employees to be tested for HIV or for on the TB or for the TB side. What we do is we encourage it, and we do it through, you know, and we did achieve, for example, in 2019, a 90% testing rate for tuberculosis as an example. And that was because it's just the right thing to do, and encouraging members to do it, but not forcing people to do it is critically important. So I guess that'll be a part of a conversation. I mean, what we're trying to achieve from a industry and country level perspective is getting at least 67% of the adult population vaccinated to create this country level. Some people call it herd immunity, but people are not herded. I think it's this is getting a population level degree of immunity is critical. And there are going to be one or two that are what they call anti-vaxxers. I think what we need to do, and this is part of the had with the trade unions and with the DMRE, is that just encouraging a sharing of the real facts about how the vaccines work. This is not a conspiracy to plant a chip in your shoulder or something like that, to monitor where you're doing and what you're going, which is part of the sort of let's define it as the fake news or misinformation that tends to be shared out in the marketplace. So we certainly are going to encourage. We can't force, but ultimately I think there'll be a high vaccine take-up, because the only way we're going to defeat this virus is getting country level immunity, and it's going to require on a regular basis probably top-ups. So a bit like the flu jab, I guess we're going to end up with a revised type of formula being given on an annual basis to continue promoting the immunity, to fight against the different strains that are emerging, or the different variants that are emerging, out of this particular strain. So I hope I've answered that question correctly. Honourable Malinga, thanks very much. If I can just talk about the vaccine preparedness. So we have obviously a significant healthcare infrastructure and capacity in place with medical doctors, with well-qualified nursing staff, with various healthcare practitioners who are readily available to be able to, we do it in terms of our screening capability and our screening work, and they are obviously ready to play their role in the vaccine rollout. So we've suggested 60,000 per day, but you've got to have the vaccine to be able to give the 60,000 per day. So a lot of this is reliant on the government procurement effort, given the fact that government is the sole procurer of the vaccines on behalf of the country. The vaccine manufacturers are not engaging with individual companies, they're engaging with country level governments. And we think that is the right thing. The government sets the national priorities. Obviously essential frontline healthcare workers are the top priority right at the front, and then you get into the other essential level workers, people over 70, people over 60, et cetera, et cetera. So we believe that's the right thing to do. But we can play our role in making sure that we administer the vaccines, provided those vaccines are available to us from a logistical perspective. There is a lot of work that's going on right now between government and organized business, including contributions from the Business for South Africa, what we call B4SA, discussion where a lot of work is going on around logistics, cold chain storage, because the different vaccines obviously have different temperature requirements, and how we manage that entire process. So I'm not sure if the analysis of the slide related to deaths and whether it's female or male was a Minerals Council question. Honourable Malinga, can I just get clarity on that, or is that a question that was posed? Because I don't see us having a little yellow piece in our slides on in terms of the numbers, but perhaps Dr. Tutula Balfour can maybe answer that question. Tutula, is that something that you picked up on?
Thanks, Chair. We collect information from companies. For some of the companies, we did not have all the information regarding the age of the person or the gender of the person. The system registered the fact that there was a person who had died, but we failed then to secure from the company what gender was this person. I think it was just one or two instances of that nature. That's how then we came to the unknown.
Right.
So it is known, we just don't have access to that information. Thank you.
Yet. Okay, Tutula, can you also answer the question about, are we worried about the 28,000 cases in mining? I think the fact is that we've done a much higher level of testing compared to the country level testing capability, and we've done that based on our screening protocols. Someone is coming from a hotspot area, they're more likely to be tested after having been screened than workers coming from another particular area. But Tutula, do you want to add any comments there?
Yeah, you are right, Roger. The more you test, the more you will find cases. And so we do have higher numbers, as I had indicated, and I think though, we have less deaths, as I had also illustrated. So the number of cases is a function of the number of tests that have been taken or the tests done. Thank you.
Okay, thanks for that. Honourable Chairperson, just moving quickly on. Honourable Masha Shalawi, just appreciate your words on the collaboration side. I think leadership in a crisis is critical. I think the mining industry with the department and the organised labour through the trade unions have also played their role in the entire process. And so just to say on that particular side, that collaboration is continuing. It doesn't, and I agree with the DG's point, it doesn't mean that the department doesn't regulate and do inspections and issue compliance certificates for companies that are not following the game. But in general, the level of cooperation at a strategic level in terms of managing this pandemic has been very important. And I think the sector has demonstrated to many other sectors that, our systems do work when they apply properly, et cetera, and we've certainly taken that particular process forward. So thank you for that comment. Honourable Madokwe, thank you very much. Just on the, you asked for some clarity on a couple of points. I'll answer the questions that were directed to us. We represent 95% of the industry by employment and by sales value. So we obviously are a dominant force, but there are many smaller operations that are not members of the Minerals Council. So, I think there's probably a number that are not within our sort of sphere of influence. We've certainly done a lot of work to make sure that our members are aware and doing their best to make sure that they comply with the different things. So I don't think that there's any conflict. The companies that are willing to donate to the Solidarity Fund on a more reactive basis to helping with the vaccination effort are much more driven by the fact that it's that they've already got in place all the right protocols, and they're unlikely to have been the companies that have been issued with Section 54s or Section 55s. But again, companies can make mistakes. No one is perfect in this world, and the DMRE inspectorate is there to make sure that where there are gaps, Section 55 instruction says you need to fix this particular issue, you need to fix that particular issue, and that helps in making sure that the protocols are being followed to the letter of what they're intended. If I can say, on the funding side, you asked the proposal to fund. I mean, we had originally, business was looking at trying to contribute to the overall vaccination effort in terms of the actual procurement of vaccines, but government through the Treasury have clearly indicated that it's the responsibility of government to procure the vaccines. So what we're talking about is our effort to roll out the vaccination effort. So using our infrastructure, using our capability, and we estimate that's roughly going to be about a 300 million to 400 million rand contribution, sort of an in-kind contribution instead of putting funds in a pot, et cetera, et cetera. But it doesn't mean that companies won't be putting aside certain amounts of money into the from a Tuma Mina basis, obviously call me basis, as the president has called us, into the Solidarity Fund for use where there may be gaps or challenges in the entire process. So we have been engaging. We've met with the minister. We've met with the DG a couple of times on the particular matter. Obviously the DMRE is not driving the vaccination effort in its own right, but they certainly are engaging with other pots within government, particularly the Minister of Health and others, and the DG of Health. And so I think what we are now clearly focused on is making sure that all our systems are in place and ready to accept the vaccines when they do arrive and when it's our turn to roll out the vaccine. But obviously that whole process about getting the vaccines here and then enabling us to get on with the process of vaccinating, from a jabs and arms perspective is very much a part of what we're trying to do. And we'll be reliant on government when that particular phase takes place in sequence of government priorities, from obviously the phase 1 rollout, phase 2 rollout. But sooner we get this rollout happening, the sooner the vaccine deals have been signed by government with the various vaccine manufacturers, and the quicker we as a country get this rolled out. Business is here to support. We think we've got an important role helping government really roll out the campaign. Honourable Chairperson, I don't know if any of my team members have any additional comments to raise or to add to my input here. Tutula, Nix, Tebello, any additional comments? No? Okay.
I think on my side, Roger. Covered, thanks.
Okay. Tutula, happy? Sitsa?
I'm happy, Chair. Thanks.
Happy, Roger.
Okay. So just to get back to you, Honourable Chairperson. That's I hope I've managed to answer some of the questions. Thank you. Honourable Chair.
Department.
Thank you very much, Honourable Chair. We welcome the questions and the comments from the honourable members. I would hand over to Mr. Msiza to start in responding to the questions. Then I will just summarize everything at the end. Thank you very much, Chair. Over to you, Mr. Msiza.
Thank you, DG. Indeed, we welcome the questions as well. And indeed, our emphasis has and will continue to be collaboration. And one of the things that I think for me it's important to highlight is that we have committed ourselves in the spirit of tripartism. We have said to ourselves as a sector that there's no competition in health and safety. So we have to share ideas. We have to work together on this matter, including on COVID-19. And indeed, Honourable Malinga, yes, we work together with the sector on the figures of the 28,000 positive cases. But what is also encouraging also is that we also have a high recovery rate of about 96%. But we still encourage the mines to be vigilant on implementing the protocols that we've also agreed upon. And just to Honourable Madokwe, thank you also for the questions. Yes, indeed. If you look at those slides where I indicated the monitoring, and we've indicated that we've done 6,000 or just above 6,000 inspections. The PPEs were the issues on the next slide that were highlighted were as a result of the inspections that were and audits that were conducted. In other words, were revealed during those inspections. Yes, indeed, we do take one of the things that there's discomfort about is the issue of Section 54 instructions. The Section 54 instructions are issued in terms of the Mine Health and Safety Act, whereby if an inspector goes to a mine and they see a behavior or a condition that might harm an employee, they can either stop a section or stop that behavior or stop the mine. I mean, I think you'll see on the slide there where there's a graph that we have issued more Section 54s than 55s. The Section 55s are more on compliance, where they will see that there's no serious transgressions. But in this case, we've been issuing more 54s because we want the sector to be very vigilant on this particular matter of COVID-19. So I think it's clearly indicative of that. However, we continuously work together with the sector of making sure that there's improvement. And what is also encouraging us emphasizes was that once we've issued that instruction, generally there's compliance, because we do follow up inspections as well. So I think there's generally compliance. And just for information as well, what we do when we issue 54s is that we require the mines to come with organized labor and present the remedial actions. In other words, they must agree with the unions of the mine that these are the remedial actions that are going to be implemented so that there should not be a repeat of that transgression that they've been identified. And we thought that we've identified that as being working because we engage also with organized labor to check whether are they fine with it, and then they will agree that they've agreed with the management. Thank you, Honourable Chairperson, DG, honourable members.
Thank you very much, Mr. Msiza. Honourable Chair, just to emphasize the point that both Mr. Baxter and Mr. Msiza covered, there was a question: if people are not going to be vaccinated, what protocols are we going to put in place to ensure that we save lives? Chair, we know that the original method or strategy of combating and dealing with COVID is still applicable. The DG of WHO has also put an emphasis on this point that the issue of social distancing, wearing of masks, and also making sure that we sanitize or we wash our hands would still actually be very important. And so when you look at the directions that have been issued, the guidelines as well, including the standard operating procedures that have been developed by mining companies, we are responding to the very same question in line with the pronouncement that the President made. Coming to the question of Honorable Mika, what is happening, Chair, is that we have cases of people that have fully recovered. That's what we have reported. And so it was just an omission that we did not put cases of people that are still in the process of recovering. And so those numbers that are missing there are the people that are between 8 and 9 days in terms of recovery. And so we have been given an assurance that, looking at their status, they will be able to recover. And when we come back, we'll not be reporting fatalities on those people because we have been given that comfort that in terms of the way they are progressing, I mean, they are promising. I think those were the only few points that I wanted to respond on. Mr. Msisa has been able to deal with the rest of the questions. Thank you very much, Honorable Chair and Honorable Members.
Thank you, DG, for that response, as well as to the Minerals Council. But let me raise this thing. I know I'm a hard person to satisfy, Roger and DG. I said when you come to this committee, maybe you want to have a take. When you come to this committee, I know you might be tended to want to say something or some things or certain things that would want to hear. And not tell us what you think has to happen, so that we ponder on some of those issues. And I will tell you why I'm raising this thing. It's because once the presentation are okay, and I think there's a lot of work, honorable members are correct, there's a lot of work, I think especially not in a comparative or competitive manner. It's quite impressive the extent of work that has been done in the sector, because I had been very concerned what could be happening, but the extent to which testing has been done, both comparatively to global and national, it is quite a good exercise. That on that part, I think there's work that is being done. But it may not be now, Roger and DG, but it's important to have a sense from where we sit as a committee, so that if there is a need for some degree of agency, we must have a feeling. When a presentation is like this, it can make people relax and say everything is done, it's going well, blah, 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 blah. So my only part as a request is that there should be something that tells us that if things goes this way, here is a potential risk. Here it sounds like a risk-free environment, except the possibility of the third wave. So I'm saying, just to get what is the impact of this pandemic in the sector? Is there something that we should be concerned about or we should be worried about, especially in a country where its economy is in such state it is now? So I would have loved to, I'm not saying you must shock us, but to make us a little bit see the need, maybe, I'm not saying we're not, but to see the other side, that maybe things we might be managing now, but if things don't go our way. For an example, it would be nice to know in your readiness to start the process of rolling out the vaccine, setting up stations, with the stop and go now that we have, did it have an impact in the sector? So that we are aware that there is this thing. The second thing that I think for me is important is that there is an issue that I know that you have answered this thing. I think Honorable Mailam was correct. There has to be certainty, whether by the department or by yourselves, although it says there should be a policy framework or a consensus agreement between the social partners on a policy in terms of the vaccine rollout. Because there is a threat that is posed in the event others do, others don't. So I would have thought then if there is that, in as much as at this stage, there's that commitment that it will be voluntary. But what happens if unforeseen circumstances take place? That's the second part. The third issue for me, which is a bit of a shock, I know it's not meant for this. Maybe it's what the MINCOSA had raised, is that in your total, if I look at the total employees of 472,000.083, you've got about only 382,905 that have returned to work. That makes a total of workers that have not returned to work to 89,178. With minor, if I'm not sure whether the fatalities or death are equal to the number that has not returned, but my assumption will be that the rest of all these numbers are based on workers that have returned. Now the question, just a matter of interest, what would have happened to the 89,178? It's just a matter of interest. I know it has got nothing to do maybe with COVID, or it may have an impact, been impacted upon by COVID. I think it's important to know that. The department, please help us, Babum Sis and DG. You have always ran short of inspectors. And part of the thing we've raised was that, can we know which areas or skills or expertise the department lacks of? Now, my big question will be, are you still utilizing the same inspectors of the department that, in my view, I would say they are quite short? And what type of skills, small skills training were given? I know taking a temperature, it's something that even today, anyone can do it. Myself, I can take a temperature. Anyone in the workplace can do that. But in terms of data collection, in terms of compliance, when it comes to the information, are we still using the same? Are they capable and up to the task? Are there no required specialized skill for this exercise to be undertaken by your inspectors? The last point of two is, I know you have set up teams and so forth. I can't get the sense, and I must say I'm worried about this. Sometimes when you present, you always agree that you are in talks, you are in engagement, but I can't get a concrete systematic system that you are using. For an example, quite soon, DG and MCs will be asking you, if we set up entities like your Mine Health and Safety Council, what becomes their role when one might say, in this environment, that is where they should be seen to be taking the lead? Now, I can't get in the whole presentation what complementary role institutions like the Mine Health and Safety Council, whether it's on PPEs and conducting inspections and so forth. I'm not sure whether that is accumulated to the department. I can't get a sense of what I heard that you need information from the employer, and the labor at a workplace level. But I can't get a sense of what is the role of health and safety committees at a workplace level, because those are the very critical things for me that can tell us that there's something that is being done. Lastly, maybe MINCOSA can help. I know I had Dr. Balfour saying that they're doing this thing. I listened to, although I was in another meeting, I couldn't listen properly, that they're doing this thing through, is it BUSA, Business Unity South Africa? That to me becomes okay. But is there any mechanism that, based on that contribution that you make, whether through BUSA and everything, is there any foreseeable mechanism that you would think has to be considered in order to fast track the process of the vaccine rollout, even if government says it's going to procure and so forth? But can we look at other mechanisms? For an example, if private health can provide this and workers do have medical aid in many spaces, do you think it's something that must be considered to say, if through private health, this thing can be accessible, we may even take into consideration to encourage workers rather than to wait for the queue in terms of the public sector, they can be able to fast track through other means or mechanism. I'm just saying, is there something like that that you think it can be envisaged? Remember, we are just a narrow committee of mineral resources and energy. You might be exposed to some of your colleagues in the different sectors of the economy when you interact at a BUSA level. I think those are the issues that I would appreciate if probably you can ever take Mr. Roger and your team, as well as the department.
Thanks, Honourable Chairperson. Yeah, listen, I think you are asking the tough questions, which is absolutely the important thing to do. And your first question was, what are we not telling you? I mean, we obviously are very concerned about the third wave. We have had in the course of the last year certain parts of the sector which were very, very challenged by the COVID-19 crisis at the global level. And I want to use the very specific example of the diamond mining sector, where effectively the global diamonds value chain was shut. And so we have had a series of discussions with the DG on looking at whether there can be some sort of relief measures put in place, whether it's relief from the 5% export levy, because obviously there were a whole bunch of arrangements in the Diamonds Amendment Act of 2006, which have implications for companies being able to survive and operate in the current very difficult environment. We had also talked about some of the other cost-related issues from a valuation service point of view, in terms of services offered by the South African Diamond and Precious Metals Regulator, et cetera, et cetera. And some of those issues were not resolved at the end of last year, and we are looking at sorting them out. We're engaging the DG on those fairly shortly. Honourable Chairperson, sorry, just I noticed one small error on the slide, and that was slide number 2 of our presentation. When you talked about the 472,000, it's supposed to be 452,000. I think someone's finger slipped there. We've got 452,000 employees in the sector, so effectively 72,000 employees haven't come back into the sector. We've done a lot of work on, and the companies did play a significant role in funding workers who obviously suffer from comorbidities or are over the age of 60, and where possible, workers that work from home, and where not possible, obviously trying to help subvent them, and obviously through the temporary employment relief scheme, which was obviously up until August, that also helped along the way. So there's a bit more work that we're doing in that particular area, but you're right, 70,000 people haven't returned back into the sector, and that's why getting this vaccine rolled out absolutely as quickly as possible is a key component of our ability to manage the entire process. I'm going to ask Dr. Balfour Tutula to provide the input on the Mine Health and Safety Council. In my understanding, there is a whole bunch of work at a tripartite level that has taken place. But when you get to things like vaccine rollouts, et cetera, it's the industry and government that really lead the charge. And so before she comes in and answers that particular question, because she is our business convener in the Mine Health and Safety Council, I just wanted to give a sense of the the mechanisms around the vaccine rollout. So the medical aids are playing a role. Remember that many workers are covered by medical aids. In the economy as a whole, our understanding is roughly about 7 million people are covered by medical aids. And in our understanding, the medical aids have committed to government to play a significant role in contributing to the vaccine funding. So it's not just government. Those who are covered by private medical aid and a certain portion of extra people are going to actually be paid for by the medical aid members as a contribution to the entire vaccine acquisition process. But when you come to the vaccine delivery process, actually getting jabs and arms, whether you're on medical aid or you're not on medical aid, there's no real difference in our view. It's going to be making sure we roll out the process with the assistance of government having procured the vaccines. The medical aids will obviously cover the cost of those who are covered. Those who are not covered will be covered through the direct government contribution of the vaccines, and we'll play our role in making sure that the administration takes place into the communities, et cetera, et cetera. So I think that's just a quick input from my side. Tutula, do you want to add on the Mine Health and Safety Council side, please? Tutula?
Morning. Sorry, I disconnected and reconnected. So I think you wanted me to talk about the role of the Mine Health and Safety Council.
In this crisis,
of course, yes, the Chief Inspector of Mines is also best placed to talk about this. There is a lot of work that has been done through the Mine Health and Safety Council. For instance, the guideline that we use in the sector on COVID-19 was developed by the Mine Health and Safety Council. So it was a tripartite initiative. We are also, the revisions have also been done through that. I believe most of, what more we could have done as Mine Health and Safety Council was also disrupted by the same COVID, in that we usually have regional tripartite forums where we disseminate information through those and in the various regions across the country. But it has not been possible to hold some of these meetings. Some of the meetings have been put together virtually, but it has not been an optimal exercise due to the impact of the COVID-19 epidemic. So the summary really is that the Mine Health and Safety Council is definitely a very important part of the response to the epidemic. Thank you.
Tutula, thanks. Honourable Chairperson, maybe just a last comment from my side is to say, I think we're at a critical stage now. The economy is in a very difficult space. The fiscal deficit is estimated to be somewhere around 12 to 15%. Our debt levels are now sitting at 81% of GDP, and the country is facing a full-blown sovereign debt crisis unless we, really see a reining in on what's happening on the fiscal policy side. But at the same time, COVID-19 is as much as it is a humanitarian crisis, it is also a unique opportunity for us to look at how we can get sectors like mining completely re-energized, reinvigorated. And that's going to take a number of very serious and key actions. And I think it's important to state that we have seen some important discussions taking place on these issues, because mining still has very significant potential in this country. We can get it back to 10% of GDP. We can attract 5% of global spend on exploration, as an example. But to achieve that is going to require some significant work, and that's quite a bit of the legwork that's being done at the moment. But the point I want to make is that we have some very short-term gaps. Let me give you one specific example. If we take, there is agreement from the DMRE on the criticality of allowing investment in private self-generation capability. Mining companies have about 2 gigawatts of potential projects that we are prepared to invest in. And that will be supplemental. It's not taking away the role of Eskom. That's supplemental energy, which is critically required at the moment, because Eskom just simply does not have the generating capacity, which is reliable and available right now, both to meet peak demand and to meet longer term demand, given the fact that we are in this just energy transition already. And so there are some blockages. There are some significant issues that we are looking at, but we've taken a really practical methodology of looking at these things to say, well, what are the environmental regulations? What are the change of land use regulations? What are the ESCOM requirements for grid tie connection? And then what are the NERSA requirements? And I think we're going and engaging with the minister and obviously DG and DDGs to look at where there are blockages and challenges. And we've got to unlock those, because these are projects which could make a massive difference. It could significantly curtail the amount of load shedding taking place, which is even taking place at 10 o'clock last night. And that would help get the economy back on track. We can't not only be constrained by COVID, but also to be massively constrained by energy or rail or others. And I've got to say, the opportunity that's in front of us is a critical one. We need to really grasp it with both hands, work in partnership to unlock the potential, the blockages that we have in place. And I think that should be a significant focus, of what we're doing going forward, in addition, in parallel to focusing on managing the pandemic, saving lives, and obviously saving livelihoods. Honourable Chair, back to you. Thanks.
Teacher.
Thank you very much, Chair. Without any waste of time, I'll invite Mr. Msisa, then I'll come at the end. Over to you, Msisa.
Thank you, DG, Honorable Chairperson, members and colleagues. Yes, indeed, Chairperson, we fully appreciate the issues that the Chairperson raised are very valid, including the issue of the Mine Health and Safety Council. And indeed, there's most of the work and the collaborations that have been taking place, not only on COVID-19, but operational health and safety, have been done through the Council, including the tripartite leadership engagement that I've referred to. It's done through the Council. I think maybe we take it for granted that Council is a DMR entity. However, I think Chairperson raises a valid issue. We have to talk more about what we do. But I think generally all the engagements, union, business, the state, we come together and then we come up with the respective measures that we've agreed upon. And Dr. Balfour also, indeed, one thing that we've agreed upon as the Council is that we've done a lot of research and we'll continue to do research, which is important, and assist with legislation, which is also important. But one thing that we've also agreed through the Mine Health and Safety Council is to do more work on dissemination. Hence, we've established those regional tripartite forums to make sure that we disseminate more information and we get input from the mines themselves on what other areas that we can look at as a council collectively. And I think we'll continuously do it. Yes, it is a challenge, the virtual engagements, as Dr. Balfour indicated, but we'll constantly deal with it. Indeed, there's a lot of work, including guidelines, the principles, the protocols. And one thing I must also highlight is that we've agreed as Mine Health and Safety Council that MOHEC, which is one of the committees at the council that focuses on health, which is chaired by Dr. Lindu Ndelu, should be vigilant on the issue of corona. And they've helped a lot, MOHEC, to advise us and also the principals on the issues of health. Obviously, they've not been working by themselves. They've been working together with the Department of Health and other entities that I've referred to earlier, Chairperson. But thank you for that input. On the issue of the resources and capacity, yes, indeed, it's one of the things that we constantly talk about in the department. In fact, we had an engagement recently on that as well. And also it helps, I think, the leadership that we get in this particular matter, also including the minister. So indeed, there are areas that we've identified that we can enhance in terms of capacity as the inspectorate to do the work that we are currently doing. And we are engaging, and we can resend the proposals that we have come up with, mainly on COVID. Because indeed, Chairperson, we are using the same capacity really to do the work on COVID-19. I'm glad and I'm proud to serve with my colleagues that they understand the important role that we play as a department in saving or assisting in improving the health and safety of the workers, including on COVID-19. And you've seen, even when we presented the first time, during lockdown level 5, level 4, our inspectors or officials or the department from the colleagues, including the ministry and the DGs, we've been going to the mines. So we came up with the protocols to enhance our own health and safety as well. But we are really proud that our inspectors, they understand and appreciate that role that we have to consistently play. However, yes, there's areas that we've identified. We can still send the information to say we still need some support in this area, but we are also appreciative that government is under significant financial constraint. However, we can also share that information. Thank you, Chairperson.
Thank you very much, Caesar. Chair, just to cover or to add on what Mr. Caesar has just responded to in relation with the issue of capacity. We have started with the department. At the right time will come, to report to you our quarterly reporting meetings. We have tried to increase the capacity of the Mine Health and Safety Inspectorate, and we're hoping that that process would be concluded before or by the end of this financial year. And so that is the work that we are currently busy with. On your question, because I know that you have been Parliament that you have been raising the issue of what is the challenge or what are the challenges, and especially responsibilities that the Mine Health and Safety Inspectorate is required to discharge. And so we are hard at work in making sure that we attend to this matter. Chair, we have also taken note, I think Mr. Baxter has covered this issue. We have taken note of the question that you have raised, which is a very fundamental question in relation with what is it that you want us to tell you that we did not tell you, which may be catastrophic, for a lack of a better word, tomorrow, should things go either way in terms of the COVID-19. I think Roger has covered it nicely, but I'll just add, Chair, to indicate that as government, we know that we are required, and we have been doing this, to collaborate with the private sector, especially when you look at mining in terms of our industry. And so it is important that we need to collaborate with the social partners within the sector. And so that work, Chair, in an event of a crisis, or if things they happen to go that way, we are ready, because our systems are already in place, and so we'll be able to attend to whatever challenge that we'll be faced with. Now, Chair, without turning this meeting into maybe economic last meeting where we are responding to the issues, allow me just adding on what Mr. Baxter has indicated in terms of our work as part of our respond to the challenge that we are having of COVID, because we know very well that we need to save lives. We also need to safeguard the livelihoods as well. And so that is the balanced approach that we are trying to come up with. And so in that regard, we have set up some structures in place. I will just touch a few key strategic issues that we are busy with in adding to what Roger has just actually reported. We have looked at the issue of social compacting. That is very important in our industry. And now the work is underway at the moment. This issue you have also raised it earlier on during our deliberations. The other issue that we have looked at is the issue of infrastructure, and we have a team that is working on this issue. The issue of the exploration strategy, we have a team that is working on this issue. The issue of the exploration strategy as well, we have been hard at work together with the Minerals Council. There are a number of issues, a good work that we are putting together. Where there are challenges, we're able to sit down, like as Mr. Baxter has indicated here, that the work is underway. Where there are issues, they come to us, then we sit down, we attend to those issues. Now, Chair, lastly, coming to the complementary role of our SOEs, you would note that we have a good, organizations or state-owned entities with distinctive roles and mandates. Now, we have those that are responsible for research, we have those that are responsible for mining, and we have those that are responsible for energy as well as regulation. Now, Chair, you will remember that with Council for Geoscience, we agreed even during, I think it was around April last year, when we issued directions, guiding that or directing that Council for Geoscience will be doing monitoring, assessing, and evaluating the risk of associated, maybe with seismicity and so forth. And so that is the work, which is a complementary work that the Council for Geoscience is doing. Now, when you look at MINTEC as well, and also NEXA in terms of their role, NEXA, we're talking of Ketlapili. They are also having the sanitizers, and so they have been doing quite very well. I think the issue that we have been talking about is the massification of the work or the production that they need to put into the market. And when you go to MINTEC as well, they have come up with some diagnostic kits and also sanitizers as well. I think, Chair, it's just that we did not actually cover this. I'm sure that is a question that you wanted to find out. What is this, or what is the complementary role that the entities are playing in assisting the department? Now, Mr. Msiza, I think even with Dr. Balfour, they have covered the issue of the Mine Health and Safety Council as well. But overall, Chair, we have taken note of the issues that you have raised. And as the department, working together with the Minerals Council and social partners within the mining industry, will make sure that we attend to these issues that you have raised, and we must act with extraordinary speed in making sure that we don't leave anything unattended. Thank you very much, Honorable Chair.
Thank you, DG. Thank you, MINCOSA, for your presentations. Obviously, as you all know, this is a very, not just sensitive, but also very critical issue that not only South Africa, not only Africa, but the globe is grappling with. So there is no way we can talk about closing, except to say that we need to have frequent interactions, and from time to time, especially depending on developments that are taking place, it is not something that we can just say we resolve and from there, that's the end. It's something that will be seized with until we get a reprieve. My request will be continue to work together, continue to engage with social partners, continue to ensure as a department that there is complete adherence, compliance, and implementation of the regulations and management of the activities. Continue to play the role also of ensuring that where possible, stakeholders are assisted moving forward. So I expect that there should be a very close working relationship, obviously including labor. If we don't do that, it will not be helping to curb the pandemic or try to put a stop. I can't agree more with the CEO of MINCOSA. This is not only just a health disaster, but it also has got very serious, devastating socioeconomic impact. And therefore, whilst we are trying to manage the health crisis that is presented by the pandemic, we also need to ensure that it doesn't wipe out the socio-economic being within our continent, our country, but also in the globe. But we'll have to play our small role, and we are dealing with commodities that are more global to some extent, or in most cases. And therefore, what happens even at a global level does have a direct impact in the sector. So I'm encouraging you, and if you need to prep us up, you must do so. We don't have to agree all the time. We just have to share. And I always say anything that is raised, sometimes it depends in the manner in which it is raised. Because one person can raise the same issue and there will be no big deal, but the other may, but simply because of the manner. So as long as we continue to engage, ensure that there is a frequent communication so that we don't disagree by non-communication. So I'm encouraging you to continue to do the work. The department must continue to play its role. And thanks for the information that has been supplied. I hope within the next time, hopefully within this quarter, or at the beginning of the first quarter, we might also invite you just to see how much inroads has been made. On that note, thank you very much, DG and your team, as well as to Mr. Roger and your team from the Minerals Council. A committee of parliament is open to anyone and everyone. So I've got no intention to say, especially the department, I have no intention to say you are dismissed. But for MINCOSA, if you feel that you've got other business matters to attend to, please, we don't want to be counted as part of the people who would have made losses for yourselves. You can go and attend to your business so that we can have a socio-economic fruitful nation, country. On that note, Ari,
Honorable Chair, thank you.
The next item will be the program, ne?
Yes, Chair.
Can you flight it, please?
There you go, Chair.
How? Hey, I'm speaking here. I didn't notice that I'm speaking to myself. Sorry, Honorable Man. I think I spent about a minute or two talking to myself. No, I was just saying, Honorable Members, this program is a program that the committee adopted before we closed curtain in last year. There are no changes. It's still the same program, except that I'm going to raise two issues. The first issue is the challenge we had with regards to the oversight that we're supposed to undertake at the beginning of the year, which was 26th to 30th January. Unfortunately, we're told on the 11th hour that we have to cancel due to the program of Parliament. And subsequent to that, we also had serious challenges with regards to the logistics, as well as the fact that there were still other programs of Parliament continuing, which we could not get a guarantee. So the proposal that we want the committee to look at is that we go back to our normal system, which we never had big problems with, and take the 26th to the, go back, Ari, to the 28th of February, I think there's only one part that we may not be able to visit, but it depends if we make things better. It's the one of the Caltex and SFF storage facility, but it is also subject because it's here in Milnerton, it's not far, but we can take advice from members if they feel that there's something we can do. Maybe they can say, because we'll have the update of the solar water heaters, maybe we can combine Paru and Milnerton. I'm just putting it, but that's what we think might be a challenge. The second thing, honorable members, in the program is that we have slotted an update by the entities that still had outstanding audit outcomes. But the limitation with that, which is scheduled for the 10th of March, the limitation with that is that it is not the entities that had not made a submission. It is the AG's office that said they could not finalize their audit. Now, March is the last financial month of the financial year. It's the last month of the financial year, as we will be dealing with the budget anyway by that time. Now, the biggest question is that on how is it going to assist us if the AG has not finalized the audit outcomes and we have to approve budgets that at the end of the day have not been processed properly. So that is the only part that is a snag. We had discussions with the committee staff, amongst other things. I think we did write to the department, but I don't think it's a correct. The department may come back to us and say, we have not received even ourselves those audit outcomes. So one of the things we're saying we need to take into consideration is to seek clarity on the status of the audit outcomes from the AG's office as we are going to prepare for the 21-22 financial year in terms of the budget. So that is one part that is a little bit of a snag, honorable members. But most of the issues, there's been no change, including that item. The only item that we could say is a slight change is the one that we're dealing with today, which we had to bring forward on the basis of what we explained when we started the meeting. Otherwise, I think generally that's what the program is. It requires then, if we are to do so, that we relook on the issues that are contained into it. Ari, am I saying exactly the correct thing?
You are correct, Chair.
Okay, honorable members, any take then on the program?
No, Chairperson.
Chair, my hand is up.
You know this thing of on and off. I see the hand of Honorable Mashaule, Honorable Volmarans. You know, remember you must always mute when you don't speak. Now you speak even when you are muted. Okay, Honorable Mashaule.
Thank you very much, Chair. I have quite a few issues that I want to raise. The first issue, Chair, is again to register our disappointment with whoever is tasked to approve or disapprove our program, especially the oversight visits that we had planned. I think it's the fourth time or the fifth time that we had to cancel or postpone an oversight visit for similar reasons. And in most cases, we do our program on time, but the approvals and the disapprovals comes as a shock every time we get a response. I want to register, Chair, that we are treated differently. We're not treated the same with other committees. A case in point would be, on the very same week we were supposed to go for oversight. Basic education was on oversight,